This is a well-known sound to all of us. You may have experienced this yourself before, but you're not the only one. Every year, over 12.5 million people find themselves shivering and sweating in the dentist chair, waiting for their cavities to be filled. Luckily, you have nothing to fear. Your friendly dentist can give you an injection, which we call a local anaesthetic. This anaesthetic causes you to feel no pain during the filling of the cavities or when your molar is being pulled out. More than 200 years ago, it was much worse. There were no anesthetics. The doctor was a strong man. He used his fists to completely knock you unconscious, so he could perform his surgery without being disturbed by the screaming of the patient in pain.
No! No!
However, knocking down all those patients every day hurt the fist of the doctor. That's when they came up with a better idea. Alcohol could also do the trick. By giving large amounts of alcohol, the patients were so drunk that they didn't even notice that they were operated. However, sometimes it could take hours before the patients were drunk enough. So they searched for a better approach. They found that inhaling chloroform, ether and laughing gas was much easier and faster to bring patients unconscious. A great method, until they found out that it was highly inflammable. That's when, in 1989, on the 24th of August at 7:30 p.m. in Kiel, a doctor named August Beer came to a new solution. He had the most brilliant idea to inject a solution of cocaine into the spine of his assistant to make his bottom half of the body numb. To investigate if his idea really worked, he came up with a couple of pain tests to see if his assistant could feel no pain from his waist downwards.
After 10 minutes, a big needle was inserted in his femur to the bone, without the slightest sensation of pain. After 13 minutes, a burning cigar at the legs is experienced as warm, but not painful. After 20 minutes, pulling out pubic hairs is perceived as stretching of a skin fold, while pulling chest hairs above the nipple is very painful. Overextension of the toes is not uncomfortable. After 23 minutes, a significant blow with an iron hammer on the tibia is not perceived as painful. Finally, after 25 minutes, strongly pressing and pulling of the testes is not painful.
The anesthetics lost its effect after 45 minutes, and our loyal and dedicated assistant had to stay in bed for 9 days because of his severe headaches, bruises and agonizing pain. With this experiment, Dr. August Beer had discovered the first local anesthetic, and thanks to him, you can now relax and dream about your next vacation when lying in a dentist chair. But how is this possible? Already 5 minutes after the dentist has given you the painful injection, the feeling in your mouth begins to fade away. To explain how this works, we first have to look at the nervous system. The nervous system consists of your brain, your spinal cord and your nerve cells. These nerve cells are called neurons. There are two types of neurons, motoric neurons and sensory neurons. The motoric neurons are used to send the information from your brain to your muscles. These are the neurons you use when you want to pick up your glass or when you wiggle your toes. But the sensory neurons are also very important. They connect your senses to your brain. So, when you smell something, you use your sensory neurons to transport this information from your nose to your brains. Sensory neurons are also used to feel pain. At the end of these neurons are small devices that can measure pain, called nociceptors. When you spill hot tea on your hand, the nociceptors in the hand are activated and they translate the pain of the hot tea into an electrical signal. Only when a pain is big enough, the electrical signal will be big enough to be transported over the neuron to the brain. That is when you feel the pain. The electrical signal which transports the pain information from the skin on your hand to your brains is called an action potential. This signal is created by a sodium influx through a sodium channel from the outside of the cell into the cell. A cell is always negatively charged, but when the sodium molecule, which is a positive molecule, goes into the cell becomes less negatively charged. Through this change in charge of the cell, An electrical signal, the action potential, can be transported to the brain via the neurons. However, when a dentist is drilling your teeth, you don't want to feel this pain. That's when you get a local anesthetic. This anesthetic consists of molecules that block the sodium channels. When these channels are blocked, sodium cannot go into the neuron and there cannot be an action potential. So your brains don't get the pain signal and you don't feel the pain. But little Pac-Mans called enzymes eat up or break down the anesthetics, and after about 3 hours all the anesthetics are completely broken down. The sodium channels are not blocked anymore and your brain receives the pain signal again. It takes a couple hours before the enzymes have broken down all the anesthetics. So if you are planning to go to a party after your dentist visit, you could also choose to just put your jaws together.